We now have a panel of healthcare experts to discuss how AI can improve healthcare. Please come to the stage. Help me welcome. We have Anmol Madan, Chief Data Scientist at Livongo. We have Madan, Global Head of R&D for Janssen Pharmaceutical Companies of Johnson & Johnson. We have Ted Goldstein, Chief AI Officer at Anthem, and their moderator, Afsana Akhter.
Great, thank you. Hello. Good afternoon, everyone. We're excited that we got you after the ice cream and the espresso. So please think of questions you want to ask us at the end. Before we begin, could I just see a show of hands, please, of folks who work broadly in healthcare and life sciences? Always curious. That's wonderful. I won't count, but it's quite a few there. And it's one of the reasons I'm really excited to be a part of this discussion, because over the years I've seen more and more MIT alums move into the industry of healthcare and life sciences. And it's a really exciting time given the degree of disruption and transformation that's happening and the really big role that AI is playing in that. So let me start by introducing our amazing panelists. On my far left, I have Madan, who is the Global Head of R&D at Janssen Pharmaceutical Companies of Johnson & Johnson. Prior to Janssen, Madan was SVP of Oncology, Immunology, and Cardiovascular and Metabolic Disease at Merck Research Labs, and was previously co-founder and head of R&D at Theravance and Innoviva. Madan received his MD from the HST program, which is a joint program between Harvard Medical School and MIT, and his PhD in chemistry from Harvard University. To the right of Madan, we have Anmol Madan, who is the Chief Data Scientist at Livongo, which is the leader in empowering people living with chronic conditions. Previously, Anmol was the co-founder and CEO of Ginger.io for 7 years. Ginger is an AI-driven behavioral health company. Anmol received his PhD in machine learning applied to human behavior from the MIT Media Lab. Immediately to my left, we have Ted Goldstein, who is the Chief AI Officer at Anthem, which is the second largest health insurer in the US with over 40 million members. Prior to Anthem, Ted was assistant professor and a cancer scientist at UCSF, director of research at Guttman Initiatives, and he has also held technical leadership roles at Apple and Sun Microsystems. Ted holds his master's and PhD in bioinformatics from UCSC. So we're really excited to have all three of you here with us today, and I think it's amazing that you bring such diverse backgrounds and unique perspectives. Now, before we dive in, I think most of us here are really aware of the overarching problem that the US is seeing in our healthcare system, right? Our annual healthcare spend has reached 3.6 trillion, which is 17% of our GDP, and it continues to grow at 4 to 5% each year. When we bring that to our homes, you know, I was at a barbecue a couple of weeks ago in Palo Alto where a family was sharing with me that for their family of 4, where they now buy insurance on the exchange, they spend $3,500 a month for health insurance. It's more than their mortgage. So those numbers are really affecting our pocketbooks, with more than half the country also on high deductible health plans. So these are real issues, and there are many underlying problems that lead to that overarching issue. And AI is going to play a big part in that. So, I have the master clicker here. I did want to share one statistic, which shows just how much healthcare is embracing AI. If we look at this chart from CB Insights, over the past 5 years, from the start of 2013 to the middle of 2018, private investment into healthcare AI startups was $4.3 billion, spanning about 576 deals. That level of investment and activity in AI surpasses that of any other industry. And I know we heard about some amazing AI feats in the talks earlier today. So it's really wonderful that healthcare has embraced AI to that degree. And the question really that comes from this is, okay, so where are the benefits and when will we start seeing the benefits? Well, based on where the investments are going, These are the three areas that we can start to see some of those benefits initially: digitization, consumer engagement, and diagnostics. So now let's turn to our expert panelists to get some real-world insights on how AI is really improving healthcare. And I'll start with the big picture question to each of our panelists. In your respective fields, what do you feel is the potential for AI to really make a difference in healthcare?
Yeah, so I think before jumping to examples, I'd love to actually even talk about the scope of the problem and the need in chronic conditions. So for those of you who are not from healthcare, healthcare represents 18% of our GDP, so massive scale. About 90% of the spend in healthcare is related to chronic conditions. And so there are basically 5 sort of important ones: diabetes, heart disease, hypertension, behavioral health, a couple more. And so we're looking at about 147 million people in the country who have one or more chronic conditions. And particularly as we think of where we need to go, and this is an election year, so everybody's talking about the healthcare system and scaling, I don't think the secret is training more doctors or staffing with more people. I think the real change that we want to see in the healthcare system in the next decade is going to come from some of the innovation and inventions in this room and outside this room. And so I think technology and machine learning and automation have a huge role to play. At Livongo, we have products in 4 of the top 5 chronic conditions today. So we have hardware, we have supplies, coaching services, integration with clinical services, 24/7 emergency support lines. So the entire package of what you need to be healthy. And the core of all of those for us is driven by machine learning and data science and automation in each area. And if I apply those principles to the broader, and I can give some specific examples now or later, but if you apply those to the broader industry, I think there's a few things that we as a society are getting really good at and have to continue to push forward. So the first is obviously understanding and predicting what's going to happen with people. Like the things that we take for granted in autonomous vehicles don't necessarily exist in healthcare today. I mean, these are some really basic ability to understand and aggregate and interpret these data is something that's new for healthcare. The ability to personalize how we think of care delivery at scale is a huge area for us. And so 99.9% of the time that a person with diabetes is spending is outside the doctor's office. So how do you get them better? How do you get them supported in those settings? And that's where the combination of the different possible classes of interventions and personalizing those just don't exist in healthcare today, right? Things we take for granted at Facebook or in social media or Amazon are just now coming to healthcare, and Livongo is spending a lot of time investing in those areas. And then the third arm is thinking about automation. And you heard some about this in the conversation about radiology and imaging, and I think this applies to more healthcare broadly. I mean, healthcare today is fundamentally a fee-for-service, human services business. And if the role of technology to come in and start shaping which of these decisions should be done by an algorithm, perhaps with clinical oversight, and where do we actually still have humans play an important role, I think these are all areas that I think are sort of broader industry trends that we're looking at very closely.
That's great. And I just want to add to that, sometimes we think in healthcare, all of the disruption has to come from the large entities such as the Anthems and the J&Js, and that's not true. The smaller companies, they're small but mighty. We just have to create enough agitation in the system for the larger entities to really take notice and start to say, okay, what are they doing? I think we need to take that seriously and either adopt it or do something else. So, Ted?
That's a great segue, because one of the things I wanted to do is do a shout out to our partners, Doc.ai, who have a booth in the lobby. Anthem is an investor in Doc.ai, and part of that is to take advantage of the kind of innovation that can happen here in Silicon Valley. Anthem is a large company nationwide. We're a Blue Cross Blue Shield licensee. We operate in many states, and of course, our part of being part of Blue Cross Blue Shield is that we offer our members in-network care across the country. And I think that's an important part of the leverage that a large company can bring to the healthcare field, and that makes convenience extremely important. An earlier speaker spoke about the number of deaths from accidents as having about 100 a day. So I was inspired to spend a few minutes on the internet during the break, and how many deaths are associated with healthcare system that are accidental or deaths that were not because of mistakes from part of the healthcare system. Not necessarily just individual errors by a physician, but collectively in an aggregate. And the numbers are staggering. It's between 250,000 by one estimate to 440,000 people a year. That's over 1,000 a day, no matter what. 1,000 a day. And so if 100 a day people die by in unnecessary traffic accidents or collisions, 1,000 a day by unnecessary medicines or accidents in the hospital. And that issue reflects also in increasing costs. And similarly, the amount of waste in healthcare, medicines that don't do people any good or may in fact do harm, statin medicine, which is extremely widely prescribed, but which has lifelong after effects for a vast number of patients. And the technology to head this off includes advanced ideas of genomics and bioinformatics to bring information-based technologies, model-based technologies, to simulate what's going to happen to a person when they take a medication. We're not using very much of that at all. So the outlook for using artificial intelligence and other things is extremely good. Right? And so we're very optimistic about this, and we think that the kind of course and redirection from useless, wasteful medications and procedures that don't do any good to things that actually are meritorious, are very optimistic.
Great. Well, thank you for those perspectives. Earlier today, we also heard a lot of discussion around sort of hype versus reality. And I think healthcare has not been immune to that. There's been a lot of hype around AI. And what we really want to see is impact. And since you've been in the industry so long and very close to AI, I'd love to hear from each of you maybe a couple of examples where you and the work you've done has really had an impact, so people can leave here really thinking, yes, this is going the right way.
Yeah, I have a couple of examples. So a big part of managing a chronic condition such as diabetes or hypertension is actually changing your behavior. So there's a number of lifestyle and behavior factors that have to change, including what you eat, your diet, your exercise, as well as checking your blood glucose on a regular basis for diabetes management. And a huge part of our effort at Livongo, as a data point, is thinking about how do we personalize the experience you have across all the different surface areas of our product and our business, including what a coach talks to you about, what shows up as information on your blood glucose meter, how do we actually surface this information on your mobile device to get you to sort of gently nudge you in the direction of the behavior change that is going to point you in the right direction. Right? And ultimately, this drives our member experience, but also clinical outcomes and the cost outcomes that we promise our partners. And so an example of that is we have hundreds of nudges that show up, for example, on our diabetes meters or on our smartphones. And so understanding what's going to work for a person. So for example, for some people, sending them a message that says, check your blood glucose before breakfast works really well. And then you see this sort of long-term sustained behavior change impact for that. And so going through the entire set of what is this, ad companies do this really well, right? So understanding your latent preferences and what you're searching for, and then using that to figure out how to get you on a path where we can change your behavior and see that in behavior change outcomes. I think that's an example that I like to cite. Another one, which is looking at a different side of healthcare, is because healthcare is very human focused, it's constrained by people. And so we have to think about how we solve that problem, right? And today at Livongo, we have 5 different coaching programs. And so if you have hypertension or diabetes or behavioral health, we provide a supporting coaching program. And so the team has done a lot of thinking around how do we create markers or how do we identify people who are likely to trigger or need a coaching session, right? So we offer a 24/7 support service. We call them diabetes response specialists. So if you measure your blood glucose at, say, 2 a.m. on a Saturday and it's outside a defined range, you have someone reaching out to you in the moment right then, right? And so getting really, really good about predicting what are the markers of that kind of person, who these people are. So when they get on our system, we understand how to support them even better. And then using that to forecast every hour of every week how we should be building the entire clinical organization. Very similar to how you heard Uber and Lyft this morning talk about the supply-demand matching problem, right? And so bringing that to healthcare is something we do today in production for every member on our system. right? So those are a couple of examples of where we really are using this.
I've only been with Anthem for 9 months, so I don't have anything of my own work to report on this, not at Anthem anyway. But we are, by the way, hiring people, so I could use your help here in Palo Alto. And but two examples that drawn from my colleagues across the company. One is that it may come as a surprise to you, but health insurance companies make more money not when you're sick, but when you're well. And so part of the Obamacare and contractual relationships actually incent us to make sure and keep people healthy. And so an example of this is, can we predict when people are going to incur various injuries or illnesses and try to head them off? An extremely important thing is falling, right? If you go, if you a senior citizen falls in the shower or off the toilet or in their home, right, that incurs a whole triggering of cascade of expenses. And so we're able to predict that based in part on age and other recent health conditions. And so literally what we're doing is calling up the individual or the family, sending out people to install grab bars and other things. So, very low-tech kinds of solutions to what could be, on the opposite end of the spectrum from extremely targeted therapies, but extremely useful in terms of keeping people well and healthy and paying premiums without incurring expenses. So that's our mission. A more comprehensive technology is what we're doing with claims analysis. And so you've all paid co-payments and such, and it's always very annoying to get a bill way after the fact. Often what happens is some small input error, such as person's pregnant, but their gender is listed as male. And of course, there are some unusual cases where things do happen. But it may be, but it's most likely a data entry error. And so using artificial intelligence and such, being able to figure out what's going on and doing automated corrections, and then trying to bring that kind of resolution immediately to it, and without human intervention. And that, of course, lowers costs too. So a lot of those operational measures are extremely important. And finally, I think being able to find the right targeted therapy. So I gave a TED talk on this where we're using machine learning techniques to identify the mutations and such that an individual has that allow us to repurpose an existing drug to a patient. And although that's not a common occurrence, it's not likely to move the needle in aggregate very much. If you're the parent of that child, you're going to be much more thrilled.
Yeah. No, those are great. We're running out of time, but I would love to hear from each one of you. And maybe, Ted, we could start from you this time. What is the biggest lesson you've learned in applying AI in healthcare?
Yeah, so one of the biggest factors, and I think that people ask me sometimes, Ted, what's so interesting about deep learning? About it? And I think one of the things that I, as a bioinformatician, were trained really to spend an enormous amount of time in doing data engineering. And I think the big aspect of deep learning is, and the thing that sort of separates where you are in your process, is this notion of one-hot encoding, really allowing the deep learning system to identify the features, to present to the algorithms the most raw information you can in vast numbers of columns in Boolean form. And that one principle, right, changes the way machine learning is done and really shifts the responsibility from the engineer or the scientist to the algorithm. And this is a huge change. It's a huge change. And I think that one principle is so important in healthcare because we have this vast information space of features and CPT codes, prescription codes, enormous numbers of diagnostics. And so healthcare is really in a position to utilize the aggregate algorithms, the new machinery, and the scalability we talked about before in ways that is perhaps in very few other fields.
Good.
Cool. Yeah. So I'm a technologist originally, and I think the one thing I learned is healthcare moves really slowly. So it's very resistant to change, and for all sorts of good reasons. And so a couple of insights have sort of popped out over the years and have shaped my thinking. So one is, you'll often hear about, Google will announce some analyses, and we heard from OpenAI and a few other folks, DeepMind doing interesting things in the space. I think in order to really bring these innovations or new kinds of models and learnings into practice, you have to think about how do you have a closed loop system, right? So if you're getting claims data from a provider, you run some analysis, that's great. The advantage we have, and I think most of our companies have, and several other companies do, is we actually have a hardware component, a mobile product, a coaching service, the entire loop. And so we can learn new models. We can figure out these behaviors are correlated with X stratification or Y outcome. And then we can put it in production tomorrow. And then we can do that again and again and again. So I think thinking about the iteration piece and how do you bring that in healthcare is really important. I think it's been a huge differentiator. The other piece that's also really interesting, and this ties to some of the discussion we heard about AV, is this morning, which is we can't run 11 million miles, right? I can't do 43 years of Dota or StarCraft simulations, because if I send the wrong information to a consumer or a patient or a member, like there are effects to that. So thinking about how do you take things like reinforcement learning, but really think about efficient learning in those classes of algorithms as you apply them to healthcare. I think is an area that we also actively invest in. So it's a team that we've been gradually building out. There's some really good work happening in academia at Stanford and elsewhere in efficient reinforcement learning and some new classes of algorithms. Because you have to, if you're learning from these data points, you have to maximize what you get from every sample, just because you're dealing with people and the consequences of your decisions.
Thanks for sharing that. Very interesting. We're going to take one question that came in on this system here. And the question is, it's a very relevant one. It relates to an individual, treating the individual versus treating a population. The question is maximizing an individual patient's health the same as maximizing the health of the population? And just to tie it to our topic, how can AI help in one or the other? So who would like to answer that?
I think one of the interesting this microphone on is a current challenge. So very clearly, right, we can maximize one individual's health at the expense of a population, right? One of the things we've seen with the anti-vaxxer movement is something where people are putting the health of one individual ahead of the community. And that's uncommon. Most things that are good for one are good for everyone. And it's not unusual for us to think about that. I think that in terms of what the AI is doing, very rare have I seen examples where where we're sacrificing the health of one individual. And one of the things about this, of course, is the expense, right? Mm-hmm. So some European countries are saying no to extremely expensive therapies $500,000 and above. And we haven't done that here in the United States yet, neither are we making it very easy to get such expensive therapies. And so I think we're going to be faced with this issue on an economic level as we move forward.
Great. Well, we are out of time. I want to thank our expert panelists very much and just close on the note of really what's driving so much change alongside the AI is the empowered consumer and the informed consumer. So we hope that this discussion and all of us can really continue to drive that movement and improve the state of our healthcare system. Thank you.
Thank you so much, Afsana.